Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. We are into November. It's November 2nd today, and I am here with Dr. Stuart Kennedy, who is Incident Manager for our COVID-19 response. And Dr. Kennedy, it's been a while since we've had the opportunity to catch up and chat on video today, so why don't you give us an update? What is our situation right now?
You know, Trace, it's been a while, but it's not that we're not working. It's certainly the whole team has been overwhelmed with the amount of doing their normal work on top of the COVID-19 and trying to keep that in control. So I think the team's been doing amazingly well, and just because of our absence from these updates, we're still trying to protect the hospital and the community. I can reassure the community on that part of it. But what's happening right now at the hospital, as of this morning, there are no COVID-19 cases, and we haven't had a COVID-19 case in this hospital since midsummer. Okay, so this is really outstanding work by all of us, including the community, who are the main people who can actually prevent COVID-19 coming into our hospitals. Certainly, we are still in the second wave. We've had a small increase in numbers over the last month. But all these increases, the vast majority have been travel related. And certainly we take that with importance. That's why we have sort of requested to limit our travel outside of Northern Ontario. But even though we've had a slight increase, our prevalence is still 0.2 out of 100,000. So we're doing excellent that way. Ontario has gone up to 1.5 out of 100,000. So we in Thunder Bay are still doing sort of exceptional, and that's because of the work each and every one of us are doing to protect each other. Our total amounts of COVID-19 in the community is 117. We only have 3 active in the community right now. But certainly, so again, outstanding work by all our departments. That includes the Thunder Bay Health Unit, that includes the City of Thunder Bay, St. Joe's, all the long-term care. The team is really doing quite well, and we haven't let our guard down, and that's why I'm hoping the citizens of Thunder Bay continue not to let their guard down.
Absolutely, and great work to the community members out there. Now, you mentioned that although we haven't been doing regular video updates, there's a lot of work happening behind the scenes. So that work doesn't necessarily impact the community or patients and families right now. A lot of it is sort of forward-thinking work. What is our hospital doing in terms of making sure that staff and professional staff, patients, care providers, care partners stay safe as the pandemic evolves?
So, as I stated a number of times, is we at Thunder Regional Hospital had to be more aggressive than with our policies than other hospitals, because we don't have the luxury to send somebody across the street to another facility. You've seen there's outbreaks in hospitals in Southern Ontario, 3 river outbreaks. Have you heard there's a number of outbreaks in Alberta, and we need to prevent that. So the incident management team is meeting more frequently now because of the concerns with Wave 2 and potentially Wave 3, that we have to be careful about, actually. So, so certainly we're looking at triggers, when to revisit all our aggressive policies we had put in place in Wave 1. So I'll give you an example. So once we have 5 positive cases in the community, the incident management team will sort of sit down and review all those policies once again to see what initiatives we need to put in place to protect the hospital again. I'm not saying we'll make any movements, but we'll discuss it. Once we get to 10 in the community, if we get to 10 in the community, we'll review where those 10 came from. If there's just an isolated pocket, we'll may not have to do any sort of increase in our sort of enhancement of our enforcement of policies, but we'll review it again. So we're looking at triggers once we get to 20 out of 100,000, or we get, 5 to 7 admissions in the hospital with COVID-19. Again, we'll look at other sort of triggers. We do not want to get back to where we were in March of this year by canceling surgery, by canceling diagnostic procedures, because we've learned a lot. But we will need to actually curtail some of our activities to make sure there's room for COVID-19 patients that come to our hospital. But the processes, the protocols will be reviewed, and after consultation with the appropriate staff and our patient and family advisors, then we'll decide what needs to be put in place. But so we're on top of it. We're looking at different triggers that will get us to a heightened sense of sort of decision-making, so we protect the community and the hospital.
So it's all of this planning for very specific scenarios and having action plans in place, I guess, or decision points in place for different situations that could arise and how we act on those.
You know, COVID-19 is so unpredictable, right? I mean, we're seeing certain reports now that it's affecting the younger population, 40 to 60 population, and also the more senior population. And certainly we need to take every single sort of case we get here in Thunder Bay seriously. The health team has been doing a great job at contact tracing, and that's the key, contact tracing, that we need to sort of follow up on where these cases are coming from. And that's why we know, even when we had 4 to 5 in the community sort of several weeks ago, we weren't too concerned because the contact tracing, it let us know that a lot were travel related. So certainly very little or none community spread. So that's important. So the message again, Thunder Bay, you're doing the right things. You're keeping your social distancing. You're actually washing your hands, and you're wearing masks. And we were one of the first communities to come out aggressive with wearing masks, and it is working. So thank you once again.
Absolutely. So you mentioned that we're continuing to ramp up our services. We don't want to cancel surgeries or diagnostic services, so we're going full bore with that. At the same time, we know we continue to watch COVID, and our emergency department active as always. Is this a safe place for people to come? When we were at the peak of the pandemic, some people were nervous about coming into the hospital and weren't necessarily coming to access the care that they needed. Are we seeing that now?
We're seeing an increase in demand because individuals and patients cannot keep their healthcare needs, at bay for a long time, or things get more serious. But some of the precautions, this is a very safe place to come because of our screening at the front door. So now we have a new protocol in place. If you traveled from outside of Northern Ontario, you will not be allowed in the hospital unless it's an urgent case. And if it can be delayed for a short period of time, we'll make certain sort of precautions that you can come back for your procedure or your diagnostic procedure that's required. Staff too, I mean, if you travel from outside of Northwestern Ontario and or Northern Ontario, and the travel isn't deemed essential by your supervisor, you'll have to stay home for 7 days and self-isolate so you don't bring the virus here that is very more prevalent in Southern Ontario and other provinces. And certainly if you are critical to the operation of the hospital, we will do a priority swab and get you back to work as long as you're asymptomatic. So we're putting those things in place to be proactive, looking at the prevalence in the rest of Canada and Ontario. We want to protect Northern Ontario and protect the hospital. So that's why those travel restrictions are in place. We're not very popular with some of our staff because of these rules, but we really feel it's our obligation to the community to make sure we keep those processes and protocols in place.
Absolutely. You have to treat them very seriously so that we can avoid any sort of shutdown, as you said. And how are things going in terms of the assessment center and COVID-19 testing in our community?
Probably better than expected in a sense. I mean, we're working in great partnership with the health unit, great partnership with our community, and again, thank you very much to the Confederation College and Kathleen Lynch who allowed us to use their site. Certainly, we're shifting. We're doing all the students and the teachers and as well as the staff at the and parents at the sort of site Confederation College. But now there is increased capacity, again, because there's low prevalence in the community, to look at bringing all our asymptomatic patients to the assessment center at Confederation College. So we're not mixing them with symptomatic patients at the assessment center. So that's where we're going to be doing the long-term care sort of visitors to help with that. And we're also going to do international travels or travel at the assessment centers who qualify for a swab. So things are really going very well at the assessment center. We got good management, a good team in place. And then hopefully we'll have our sort of more permanent assessment center coming to opening in hopefully mid-November. We're all ready to go there, but we've had some sort of supply problems getting sort of a needed door in place, and no fault of our own or anybody else, but there is some supply issues, again, because of the demand out there. So hopefully that will be in place by mid-November, so we don't have people waiting outside in the trailers in the emergency department.
Right. And a good demonstration of how we're constantly adapting and changing to meet the needs in the community. The needs in the community change based on testing criteria and standards and what is required for things like entering long-term care.
Yes, and we're still encouraging people to book one appointment at a time because certainly I know they're anxious to make sure they get in, but we have a lot of no-shows, and each time someone doesn't show up for the appointment, that actually prevents somebody else from getting in a more timely sort of fashion. So just try to be respectful, keeping your appointment, and being respectful of others to make sure you show up for your appointment.
What are the turnaround times for results these days?
You know, they're still variable, you know, in the sense, I mean, some time we should get as long as travel, and you know, just to remind the public that we do some priority swabs here at Thunder Bay Regional Hospital. We do a number at the Public Health Unit in Thunder Bay, and they're going to be increasing their capacity.
Public Health Lab.
Public Health Lab, thank you. And they're going to be increasing their capacity over the next several weeks, probably by the end of November, maybe even double their ability. They can do it here in Thunder Bay, so we don't have to send it out. And then we do have to still send a number, quite a few, to the Public Health Lab in Toronto, and now they're also using Winnipeg. But the turnaround time could go anywhere from 3 to 5 days, and certainly that's still not where we'd like it to be, but it's better than 7 to 10 days as it was just several weeks ago.
Absolutely.
And it all depends on the backlog in the province. All of a sudden there's an outbreak someplace else in the province, our backlog, our sort of turnaround time could increase, but they are increasing the testing capacity throughout the province too.
Right. And I think important to note as well that anyone who is symptomatic, depending on what the symptoms are, the severity of the symptoms, generally they can get a test done the same day as calling. That's a really important piece to know too.
Either book online or actually call, and that's a priority population we want to get done as soon as possible for the symptomatic patients.
Yeah, so if people are symptomatic and looking for a test, the best opportunity is to phone the assessment center and they'll do a triage for you. So great. Okay, so that's a lot of updating in one little video. Is there a final sort of message that you want to provide to the community today?
It's good to have boring news as sort of in being in charge of the incident management team, because boring news means we've got some control of the situation. So that's why we haven't had the sort of updates, because we just have boring news right now. But boring is very, very good. Let's continue to be boring, but just to let the public know that this is not a short-term haul. We initially expected 6 months to 9 months, but I think fasten your seatbelts. This is going to go on for a year or two. The vaccine will be somewhat helpful, and we expect that to come sometime in the summer months, I would hope. Then you got to distribute the vaccine, and then you have to see how effective the vaccine is, and because this virus has many mutations, it can change so quickly. The vaccine has a lot of work to do to be highly effective. So it's going to go on for a while. We got to learn to live with this, and certainly, and you got to continue to take those public health precautions because it's not going away.
From a family physician perspective, Dr. Kennedy, what about the flu shot?
Oh, absolutely. Get your flu shot and get it as soon as you can. We do expect a low flu season based on our data we had from both South America and Australia. That's because you're practicing those public health, sort of procedures, which is wearing a mask, staying a distance, washing your hands. But certainly having the flu and COVID at any one time in the community could be devastating. So please get your flu shot. I think it is very effective. Gives you a bit of a sore arm. That's a small price to pay for preventing the flu here in Thunder Bay.
Thank you so much. Thanks everyone for watching.